Blepharoplasty is the most common facial aesthetic procedure. It can be divided in upper and lower blepharoplasty, and it generally involves excision of excessive eyelid skin with or without orbital fat. In this way, we can achieve an eyelid lift and give the patient a more refreshed appearance of the delicate area around the eye. There are some conditions that urges someone to seek for a blepharoplasty. The upper eyelid skin loses elasticity, becomes droopy, and can even obstruct the peripheral vision. Similarly, the lower eyelid skin also relaxes, and according to the mid-face descent, leads to an under eye area that becomes hollow or puffy and gives a tired look to the patient. In the same time, the underlying septum also relaxes and can lead to herniation of the periorbital fat. A blepharoplasty that is well planned and individualized according to the particular circumstances can refresh and rejuvenate the area around the eyes and leave the patient to a more awake and youthful look. Risks from blepharoplasty surgery include asymmetry, inflammation, and dry eyes, ectropion, especially associated with lower blepharoplasty when a poor plan can cause a downward retraction of the eyelid, and bleeding, which is generally a low-risk complication, but when it is not identified and treated promptly, can lead to serious problems. Special considerations, a more cautious approach, or even avoiding blepharoplasty is suggested in patients with active inflammation, previous trauma, dry eyes or excessive tearing, thyroid dysfunction and anticoagulant medication, significant brow ptosis, very loose lower eyelid skin, and insufficient bony support with protuberant eyes. Upper blepharoplasty is usually performed under local anesthesia. It involves the removal of a pre-operatively marked part of the upper eyelid, followed by a targeted cut in the muscle fibers and individualized treatment of potentially excessive underlying fat pads. It can also be performed with the use of a laser. Lower blepharoplasty, on the other hand, involves a wide range of procedures, and it can be performed under local anesthesia, sedation, or general anesthesia, with either an incision just underneath the last line or from the inner aspect of the lid. It can involve from just even a removal of a strip of skin and as we call it a pinch blepharoplasty, to a more complex procedures involving fat manipulation, lateral canthus repositioning, or even a mid-face lift from the same incision. Generally, there is a degree of swelling and bruising after blepharoplasty surgery and an average of 1 week to 10 days downtime when a patient is able to return to work. No aspirin and non-steroidal anti-inflammatory and anticoagulant medication or vitamin E before the surgery, and head elevation, avoidance of excessive physical activity, and cold pads for 3 days after the surgery can help the recovery and are advisable.